Today. So today I am going to be showing all the ladies in the house how you can do your breast examination at home. And knowing how to do your breast examination at home will really help to help you to identify breast lumps. So I have my lady here, I've taken consent from her, and then I'm exposing her breast for you to see. So when you go in the shower, so assuming this is you in the shower or in your bedroom, so firstly I want you to put your hand. Let me face the camera so you can see me well. So firstly, you can put your hand, and if you have your child as well as a mom, you can ask your child to check your breast on you. You put your hand, relax, and tell your child, can you look at my breast and tell me if there's any changes in my breast. So if your child see it or not, and even you don't have a child, sit down and look at it and see if there's any changes in your breast. And then you can also put your hand on your hip and push your chest out like this, and also ask if your husband is there or your child. Tell them to help you check your breast for you, and see if there is any mass or anything that is hanging. And also you can put your hand behind your head like this and bend forward. Also ask your son to check if one side of your breast is bigger than the other one, and also if there are changes that I'm going to discuss with you now. So now, after you've done that, you also have to inspect your breast and see if there's discoloration of your breast muscles. Discoloration means that different colors, like someone having maybe yellowish color on the breast, so you have to check that. Also, you have to check for dimpling, when you see like your breast looking like orange skin and dimpling like that. So you have to also mark for that, so you can check that by yourself. And also you also have to check the area around your nipple, like this nipple here. You need to check the area of your nipple and see if your nipple, like this nipple, they are two nice nipple and they are very, very prominent. Check if your nipple is there, or if your nipple is going this way. If your nipple is going like this, it's disappearing, we call it dimpling. Dimpling of your nipple, that's the time that you need to also report to your doctor. Okay, so after checking that, you can also use your hand, even though you're menopausal or you're still giving birth, as long as you're not breastfeeding as a woman, and you press your nipple and you see any water, discharge, mucus, milk coming out of your breast, it's an alarm, like alarm bell. So you need to go and see your doctor. So you press your nipple and see if anything will come out. Also, even if you don't press your nipple, also watch out if there's anything that come out. You smell it if it is smelly as well. Now, after you finish that, then all those one was inspection. Now you have to do palpation. So I'm going to show you how to palpate your breast. So you've watched a lot of videos on how to palpate breast, but this is a simple one for you. I'll be able to help you to know how to palpate your breast. So you have to start palpating. So you lift your hand like this and put it at the back of your head, and you lie down on your bed and you start to palpate. So like here, right? So I'm going to use this to demonstrate. So you start to palpate your breast, so you palpate it and give it a deep palpation. Sorry, I'm using this plastic, it's a bit, so you can see I'm going it in a circular motion. So I'm actually finding a lump, so I have to press harder. So that's what you do to your breast. So it's not a joke, because when some women say they're examining themselves, they just do this and do that and say no, nothing. Whereas if you press in, you do that and you press in, you might pick up something. So that's why I'm showing you here. You need to palpate round and round, and make a deep pressure on the breast tissue Okay, if you are doing that, you're in pain, also you need to report to your doctor. And then you need to also palpate here to the tip of the breast and also to the axilla area. You repeat the same thing on both sides of breast. You start from here, from the nipple, press it down and press it deep. You're looking for lump. You can teach your girl child, if you're a woman, can teach your baby girls. Okay, like this, my lady here. What is it?
Lady Cafe.
Huh?
Is it live right?
That's okay. So like this, my lady here, she has a lump here. I just pick up a lump here, so I will come back to it. So there's a lump here. So deep palpation will help you to find the lump. So this is her left breast, so and she has the lump. So you palpate it to the tip, but it has to be deep, like you see. If I don't go deep, I can't find this lump. And this lump is like, it's firm, attached to the mammary muscle, attached to the tissue, the breast tissue, and it's about 2 to 3 centimeters. Okay, and it's not painful. And the surface of this is irregular. It's irregular surface. Okay. So for this patient now, I'll tell you what we do with that patient. So for you, when you finish palpating your breast, you need to also palpate your armpits like this. So you lift your hand and you palpate your lymph nodes here in your axilla. So you go from the, you can start here from your cervical, from your neck, you palpate, okay, and then from your axilla as well, you palpate, and also palpate on this side. What you're looking for is any swollen lymph nodes. And then when you finish palpating that, you do it up to the tip down here. That's how far you can go, up to here. So I'm going to demonstrate it here. So you palpate it here. That's inside your axilla. So you palpate it, and then you come to the tip of it, and you come to the side, you come to the side, and you come down here, and you come to the neck, and also palpate. You can do that for yourself. So if you find a lump like here, like this lady, I found a lump here in her breast. So this is the time for you to come and see us in the clinic. So you come to the clinic and show this lump to the doctor. See, the lump is here, and the doctor is going to refer you to the oncology team under 2 weeks wait, and that lump will be removed and you're going to go through chemotherapy. Thank you. That's what I have for you today. Thank you very much. Bye.